Spending weeks and months and your tennis elbow is not getting better? Have you tried cortisone injection? Cortisone is a steroid which is catabolic in nature, which helps to reduce inflammation, reduce swelling and pain drastically. So I'm going to tell you much about the tennis elbow and the use of steroid injection. Hi, this is Dr. Jitu Mishra from Active Plus. Today we're going to discuss about tennis elbow. Tennis elbow is a strain injury which happens because of repetitive strain over a long period. For a tennis elbow, if somebody has tried physical therapy, chiropractic and other therapeutic techniques to reduce the inflammation and pain, and if they have not solved your purpose, you are right, over 1960s till now, and it has served millions of people with their pain. And once the steroid is given and patient is asked to rest for 3 to 5 days, rehabilitation or the exercises for the patient can be started 3 to 5 days depending on when the pain subsides. Steroid shot does give you some pain because the fibers which are ruptured due to the injection and the anesthesia which is applied increases the recovery of ruptured tissues and increases the healing in various aspects. So the tennis elbow comes with different severities from moderate, mild to severe. People who initially should start with physical therapy, rehabilitation, exercises, the natural way of recovering. Once the therapy has gone beyond 2 to 3 weeks or 4 weeks, person should be advised to take cortisone injection if natural way of treatment is not working. The time is crucial. Patient has suffered for more than 8 to 12 weeks. Now it is the time that cortisone injection should be tried for the elbow. Elbow is a very notorious joint. It has various functions. It is enabled to even lift, use his wrist, elbow at any angle. The sleep gets disturbed, so cortisone becomes necessity at that level to reduce the pain immediately. Watch the complete video how the procedure of cortisone injection is done to a patient who visited our clinic. Today we have Dr. Akash Sabharwal, who is MS in orthopedics and has a fellowship in sports from Australia. Dr. Akash Sabharwal has worked and is currently working with various sports teams. He has an intense experience in dealing with the sports injuries. If you are suffering with any of the following sports injuries, please contact Dr. Sabharwal and Active Plus today. First procedure is done is cleaning the area before applying any injection. Now as you can see that we are putting betadine to clean the area further where injection has to be applied. Before giving steroid shot, first the anesthesia is given so that the pain reduces drastically. And patient is comfortable with the injection, and post the injection he can travel without any pain. After the anesthesia, patient is asked to wait for 2 to 5 minutes till the anesthesia starts working. Once the anesthesia starts working, then the doctor starts pinpointing the points of the muscle where the steroid has to be injected. Injecting the steroid takes some time as the fibers have to be felt slowly.
All along this, ना? वैसे ही हम जहाँ पे इंसर्शन है वहाँ पे स्क्रिपिंग कर देते हैं.
Okay.
So it leads to bleeding.
Yes. Yeah.
पेन हुई?
हल्की सी.
हाँ, localized है.
This is the scraping technique which doctor is using, so more of the bleeding happens around the affected area so that the inflammation can be reduced post this injection. Please watch how finely the doctor is using scraping technique and how well he is experienced dealing with this patient. Technique used for injecting steroid is not easy, so we should not be rushing to get the injection done at any place or by any doctor. The specialized doctor should be consulted who has experience dealing with such injuries. Doctor also tells the after effects of the injection, how long the pain will remain post this injection is done, and how fast the patient will start recovering from the steroid. Again, to mention that the cortisone injection is not an anabolic steroid which increases your performance. So viewers who are watching it and are from the sports fraternity, you should not try this cortisone injection as a performance drug, and you should never try and get injected by yourself. You need an experienced hand, a doctor who's been dealing with the sports injuries for a very long time. During the procedure, a lot of precaution has to be taken. The patient can have a drop in the blood pressure and can have a dizziness. So those things are also mentioned at the clinic under the supervision of a doctor. If you like our content, please subscribe our channel and hit the like icon button so that we can keep providing you more and more content related with these sports injuries and aches and pains. Now the doctor is reassessing the condition of a pain after the injection is done, and he's trying to extend the elbow, wrist, fingers. Patient gives the response how much pain has reduced and how well he's coping up with this injection.
10 में से let's say